Welcome to This Week in Health IT News, where we look at as many stories as we can in 23 minutes or less that is going to impact health IT. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT. I've set up podcasts, videos, and collaboration events designed to develop the next generation of health leaders. It's Tuesday News Day, and we're going to ease into the new year with by taking a look at the predictions for the upcoming year. Instead of, as you know, we normally take a look at the top 10 news stories, and I give you my take on it, and then circle back on a couple of them and go into a little more detail. For this, we're just going to take a look at 10 predictions that people are putting out there. I took a look at 10 stories, and then I'm just going to, some of them were the same predictions over and over again. We're just going to look at 10 predictions from those various stories. We want to thank our founding channel sponsors who make this content possible, HealthLyrics and VMware. If you want to be a part of our mission to develop health leaders, go to thisweekhealth.com/sponsor for more information. And you're going to want to stay tuned on that front. We will be announcing 3 more channel sponsors here shortly. Thanks to Drex DeFord, who helps me with research with his new service, 3X Drex, where you get 3 stories texted to you in 3 stories, 3 days a week. To sign up, you just text Drex to 484848. All right. Again, for those of you who are watching this on the video, this is a bucket list item. We are renting a place for December, January, and February. And this is in between us moving out of our old studio and into a new studio, or you can take that as moving out of our old home and moving into a new home. So, and we decided to rent here at Sunset Beach, and the views are breathtaking. So hopefully you'll get some of that in the background. All right, here we go. You know, here are the stories I'm pulling from. There was a Fierce Healthcare story. Editorial Advisory Council offers insights. That's a good story. Significant advances in 5G, AI, and edge computing. CBS Interactive. What's next for health? 5 predictions for 2020. That was HealthBox. Good article. Healthcare executives on topics to follow in 2020. Health Leaders Media. 2020 will bring massive change. Why society might not be ready. Barron's. That's a completely different story, by the way. I read that. I'm not going to quote any of it in this episode. It is worth a read. It's really looking at the mega trends across society, and just some things that really stretched my thinking, and I think it will for you as well. Took a look at Peter Diamandis. In 2030, Amazon and Apple will be our doctors. Agree or disagree, Fast Company article. Shift to cloud, renewable energy, top CIOs, sustainability agendas, Wall Street Journal. 20 in 2020, IT leaders dish out predictions, CIO.com. And 10 healthcare trends to watch in 2020 from Rod Hochman on LinkedIn. Definitely worth a read. Rod is a great thinker in our industry and former guest of the show. And then the last one was doubling down. HIT leaders discuss their 2020 visions. Health Systems, CIO.com has some of my favorites in there, some former guests of the show, and really like some of the things they were saying. But before we go into 2020, let's take a look back. There's a really good article down here. It's probably in December if I thought about it. Healthcare IT News, here it is. Healthcare IT News did an article, Healthcare IT Gains New Ground, and they took a look at the main stories. And just so you remember where we've come from, there's a couple stories here. So in 2019, social determinants of health got attention they deserve. And I think that's really true. 2019, we talked an awful lot about social determinants. VA looks back on 2019, sees a year of improvements and continued progress. The VA is implementing a new EHR, as well as doing just a telehealth, a lot of really cool things. Look back at the past decade of UK health informatics. EHRs in 2019, still a source of frustration, but getting better bit by bit. Providers innovated patient engagement and experience in 2019. Healthcare security took the forefront. Forward-looking providers made strides in AI in 2019. We had this goofy thing about Apple buying Epic in the middle of the year, and might as well put the story out there because we ended up talking about it a lot for some reason. People got all jazzed about it until people started to sit back and really think about it, and it was like, Apple's never been a enterprise software company per se. I know somebody will argue that, but they are not buying Epic. You had a bunch of stuff on AI. Eric Topol wrote his book that came out. You had Chris Ross, Mayo Clinic CIO. This artificial intelligence stuff is real, he announced at the Healthcare 2.0 conference. Don Rucker was interviewed, state and next frontier of interoperability, talking about FHIR version 4 and a bunch of other stuff around AI and other things that are out there. Northwell, Allscripts Northwell Health to co-develop new AI-powered EHR. So those are just some of the things that went on in 2019. Just to give you a feel. And actually, I think one of the things that's interesting is what I've been telling people is the most important article or most important story from last year, and they didn't even cover it. And I think partially because I get looks, because I think the most important health announcement of the year came from Cerner. And when I said this last time in a large group, people looked at me like, what? Cerner's irrelevant. Well, they're not really. They signed a significant partnership with Amazon AWS. And for those wondering if big tech is going to get into the EHR business, they did in 2019 with this announcement. The partnership, AWS is now really the engine that is going to fuel Cerner's rapid progress and advancement. And there could be a potential purchase in the future, but if the partnership's done right, it's not really necessary. And it appears like they've driven a really good partnership between the two of them. And so now you have the AWS rocket engine strapped to Cerner. I think it'll be an interesting year from that perspective. Anyway, going beyond 2019, let's take a look at what some of the things that people are saying for 2020. Some of these I agree with, some of them I disagree with. I'll let you know which are which, and I'll throw in a couple at the end that I'm keeping an eye on. This is from Dick Daniels, CIO, Kaiser Permanente, said that his hospital and health insurance company is investing in making their data centers more energy efficient. To that end, some of the initiatives include wind power, natural gas without combustion byproducts to generate power for some of its data centers. I think in 2019, I think the CIOs are going to be asked to go green. Believe in global warming, don't believe in global warming. It almost doesn't matter at this point. A significant number of people in your community believe in it. They also expect health systems to be global citizens. And healthcare, and actually what's interesting to me is there's an awful lot of people who believe that global warming is a health issue. And it's a lot of issues, really, when you think about it. It's an energy issue, it's an environment issue, and clearly it can be a health issue. And so because of those expectations on the health system to be a good global citizen, I think the CEOs are going to be asked those kinds of questions in forums, and I think eventually the CIO is going to be asked. I think Dick Daniels is right. I think this is one of the things that we're going to need to keep an eye on. The second one, return to home-based care models in earnest. Craig Sammet, President and CEO of Blue Cross Blue Shield of Minnesota, and he said, given the growing unaffordability of volume-based and facility-centric care delivery models, we'll see a return to house calls and explosive growth in home-based care models. 2020 will likely see health plans, technology companies, and retail entering home-based care in earnest, all with a desire to reinvent care delivery. Now, some of these have sort of a bent of, of course, somebody from the payer is going to say this, but I think this is really a real trend that is going to happen, and really it's about time. Care is finally going out of the hospital itself, and I think we would all agree it's about time. It's very expensive, and there's a certain amount of risk to it. Clinics of all shapes and sizes are popping up across the landscape. Some are run by health systems, some are, actually, they're being run by a lot of different things. They're being run by employers, being run by venture-backed groups, some retailers. Walmart obviously is getting into it. Amazon Care, Amazon's running, that's an employer program. It's a lower cost venue, and it's really becoming the preferred choice of many. But I agree with him that this is just a stepping stone to some more bold moves in telehealth and home-based care models. So I think this one's going to accelerate a little bit. You always have to look at the financial models and where it makes sense, because that really will determine the speed at which something moves. But this is gaining some traction, and it's a way for new entrants to compete, and so keep an eye on that. So a lot of predictions around telehealth, but quite frankly, we could go back to 2014 and to just replay the same predictions, 14, 15, 16, 17, 18, 19. Now in 2020, we're saying, hey, telehealth is going to set a new standard for care out there. I'm not knocking anybody who's making this prediction. I would love this prediction to be true, and I think it will make some serious progress in certain areas within healthcare. I think visits that don't make sense. We saw this in New York with orthopedic. After surgery, people are doing telehealth visits. You don't want to drive into New York. It's hard to drive into New York. It's expensive to drive into New York. So if you're in Jersey and you have your surgery done in a New York hospital, the follow-up visits being done via telehealth, and I think there's a whole bunch of use cases where it is expanding. But as we heard from Dr. Klasko, doing this requires health systems to cannibalize their revenue. Unless they are a payer, an insurance carrier and a provider, it requires them to cannibalize their revenue, and it's really hard to make that case to anyone, especially your board. And so I think for that reason, it's going to become a weapon of choice for people who are looking to be new entrants and competitors in those space. And then eventually it's going to have to be a defensive strategy. In highly populated areas and in reaching out to rural areas, I still think it's a very good strategy. So if you take markets that are densely populated, Chicago, New York, LA, San Francisco, and others, you could use telehealth as an offensive strategy to take patients away by utilizing convenience. So, will telehealth take hold this year? I think health systems are going to move slowly because they have to cannibalize their revenue. But I do think it will continue to make that progress. I think the VA announcement was huge last year, and I hope to see more of those kind of things, breaking down the barriers between states. Recently saw I think it was the AMA, support the cross-state licensure. I forget what it's called, some pact or something. So again, I expect to see a lot of movement there. A bunch of 5G announcements or 5G predictions. 5G will enable all sorts of new solutions. Color me a skeptic here a little bit, and I don't get me wrong. Keep an eye on 5G. When 5G is implemented correctly in earnest across the country, it will completely change the landscape of just about every industry. With that being said, we're not there yet. What you're seeing right now is, you have T-Mobile saying, hey, we're doing 5G across the country. They're doing 4G plus across the country. So it's just a slight improvement until we get the next level, which is really building out requires a lot of infrastructure build out. And there's some other things to overcome, like the signal going through walls is not as good. You're going to have carriers. This T-Mobile and Sprint merger is really important because Sprint has all this bandwidth. They have the different layers of bandwidth so that they can do long haul and into buildings and all sorts of other things. And that's why that merger is so important for T-Mobile and for Sprint. T-Mobile has the cash to take Sprint's bandwidth and really put it to use. But anyway, regardless, here's the thing around healthcare on this. There's a lot of solutions that we could be doing on 4G that we're not doing today. So I'm not sure why all of a sudden we think 5G is going to be available and we're going to start doing a whole bunch of stuff that we could really be doing today across 4G. So yes, it is going to be transformative. No, it's not going to be in 2020. Keep your eye on it. Stay close to it, especially if you're in a major market. They have implemented it in some markets, and so it might be something you are looking at this year if you're in one of those markets, but very few markets have done it at the higher speeds. The fifth thing, AI and machine learning. A lot of predictions around AI and machine learning. I'm sticking to my premise here, which is huge advancements in administrative and IT uses, using it around security, using it machines, managing machines, if you will. As your network becomes complex and you have to manage exfiltration and those kind of things, machine learning and AI used in those cases, RPA being used in the repetitive tasks, call centers, AR, you name it. I think you're going to see it. You're going to see it expand there. I think it's going to be slow on the clinical side, although some people disagree with me. They say big push in clinical this year. I think we're seeing it replace some of our some of our analytics models from the past, but we're not, it's replacing some of our sepsis models, it's replacing some other things. But really, the promise of AI is real-time culling of the information and providing support to the people who are delivering care in real time. And I think that's still a little ways away for a couple of reasons. One is we lack the credibility we need with physicians, and we're still earning that back with some poor EHR implementations over the years and some other systems. And so we can't just walk in and say, hey, this is the future. That argument just doesn't cut it anymore. We have to truly implement this in a collaborative way. And that takes time, and it takes some savvy and sophistication in the form of the CIO leader. The second thing is some clinicians are calling for clinical trials around AI, and there's some concerns around the black box of AI, both of which are probably valid in a clinical setting. If we were doing a new drug, we would ask for clinical trials. AI and machine learning has that same impact, and we are going to be making decisions off of these things. We probably should put them through a little bit more significant, rigorous testing before they get deployed. So I think it's going to slow down the clinical side. Not that we're not going to see progress, and not that we shouldn't be investing that time right now so that we see significant progress in 21 and 22. So again, AI and machine learning is the future. I agree with Chris Ross. I agree with everyone who makes these predictions. I'm just trying to fine-tune the timing of it, if you will. Data. The predictions around data are all over the place, but the reality is we're still using only about 10% of the stored data in healthcare for analytics or intelligence of any kind. And that's really unacceptable. And so from that perspective, everyone's predicting that we're going to start using the other 90% or really make inroads. And there's a lot of different ways that that's being said. We're going to see, we have a lot of this stored in data lakes. We have a lot of it tied up in different silos and those kind of things. And so there's people predicting new tools that are going to come out. There's people predicting new methods are going to come out. I'm really a strong proponent that I believe two things are going to win out here. One is I think some people are just going to throw it over to the fence and say, hey, Google, hey, Health Catalyst, hey, fill in the blank, Amazon, potentially, Microsoft, hey, I'm going to throw this over the wall. Can you help me to implement these new tools? And I will bring the algorithms and the analytics and the healthcare knowledge to bear. I think you're going to see that throwing over the wall kind of thing is going to be primary. The second thing I think you're going to see is service providers that are really good at this, health. If they have the tools and they have the people, are really going to do well in this space. So I think you're going to see a lot of partnerships and a lot of vendors really focusing in on this data side. And we'll get back to our show in just a minute. As you know, Health Catalyst is a new sponsor for our show and a company I'm really excited to talk about. In the digital age, cloud computing is an essential part of an effective healthcare and precision medicine strategy. And we've talked about it many times on the podcast. But healthcare organizations themselves are still facing huge challenges in migrating to the cloud. Currently, only 8% of EHR data needed for precision medicine and population health is being effectively captured and used. That's 8%. One of the things I like about Health Catalyst is that they are committed to making healthcare more effective through freely sharing what they have learned over the years. They published a free ebook on how to accelerate the use of data in the delivery of healthcare and precision medicine. You can get that ebook by visiting thisweekhealth.com/healthcatalyst. And this is a great opportunity to learn how a data platform brings healthcare organizations the benefits of a more flexible computing infrastructure in the cloud. I want to give a special thanks to Health Catalyst for investing in our show, and more specifically for investing in developing the next generation of health leaders. Now back to our show. All right, coming in at number 7, Rod Hochman, again, a great thinker. I have two of the things that he said in his article of his 10 trends. The first being the race to bring voice-activated technology to healthcare will heat up and will be a central feature in the hospital and clinic of the future. We have talked a lot about this on the show. We've had several guests. We've highlighted Orbita and others. on the show as well. I absolutely agree with this, 100%. I think it's a given. I think 2020 is the year where you're going to see this just everywhere. You saw the partnership with Nuance and Microsoft. You see, Orbit is making waves. You see Amazon doing partnerships. It's just, you're going to see this be a major theme in 2020, no doubt. Number 8, new alternatives to Medicare for all will emerge in the presidential debate. One viable option should be taken seriously: free primary care for every American. Rod Hochman. Well, I hate to disagree with Rod on this one, but I understand where he's coming from. As a health system CEO, I would hope for free primary care for everyone, because someone is going to pay for that. And probably that's the federal government. And if the federal government pays for it, that means that all of a sudden his health system and all the other health systems just got a significant windfall of money, since they have a majority of the primary care physicians in the country. I don't think that's going to be a viable option, and I don't think that's going to really get any legs in the 2020 election cycle. But I do think he's right in the fact that the presidential debate is going to kick up all sorts of new thoughts and ideas around this. And one of them is we've started to see rumblings of this Medicare Advantage for some, or Medicare Advantage for all, I guess is a way of saying it. Medicare for some, Medicare Advantage for all. I think will start to become a talking point at some point as sort of the centrist view on this. And Medicare Advantage has been pretty good for health systems, pretty good for the people who have it. So I could see people starting to have this conversation. This isn't a political show, so I'm not going to get into it in any way, shape, or form. But I think that is going to be the conversation for 2020 that we're going to hear the most of. And we'll hear, obviously, both the other sides, which is, make it a true market, as you do in capitalism. And we'll hear the other side, which is, completely centralize healthcare and turn it into Medicare for all. So I think we're going to have that conversation. One thought on the election cycle, I just want to throw out there, and I just want to keep saying this because Peter Diamandis has this quote in his article where he says, "Healthcare is the biggest business in the world, and it is phenomenally broken." And you're going to hear a lot of this kind of stuff in spades in an election year. You may be convinced that our health system is so bad that you should go outside of the country. And I know in that any of the last 2 or 3 elections, that may have been how you felt. I should go to Canada to be cared for. But the reality is we continue to export our care around the world. People seek out our healthcare. Our healthcare tourism business is thriving. We have the best healthcare in the world. We aren't necessarily the healthiest country in the world, and you can blame that on a lot of other things. But we have some of the best healthcare in the world, period. So it's going to be a tough year. It's an election year. People win points on creating some fear, uncertainty, and doubt around that. Our healthcare might cost a lot. We have some things to fix for sure. Absolutely. But we still have great healthcare in the United States. Number 9, self-funded employers will play a larger, more creative role in risk and care management. This is absolutely true, and this is going to continue to make progress in 2020. And I'd like to say that we're going to see significant movement in 2020, but I think that, again, it's probably 18 to 24 months off. Amazon Care was a big announcement this year, and I think that's interesting. Apple has their own program that you still have Amazon Care separate from the JPM, Berkshire, Amazon Haven announcement, and we really haven't seen where that's going to take us. So I agree. The cost of care for their employees is still a major concern for many employers, and they are taking matters into their own hands. So that will continue to be a trend and a strong one in 2020. And then finally, value-based care will accelerate the merging of social care and medical care systems. I hope so. I doubt it, but I hope so. And the reason I doubt it is because I don't think the financial models line up, and we are relying on the mission of health systems and in the hope that they will act in the best interest of their communities. And to be honest with you, not all the incentives align in that way. We had that conversation with Dr. Klasko, where he said his incentive as a CEO did not align to that objective, to taking care of the people in Philadelphia. It didn't really align to that. It was really about the business. And so he pushed them to align his incentives with improving the care of the people of Philadelphia. And if more health systems and CEOs do that, I think that will make progress. I'm not sure that has happened yet, so that's why I'm a little skeptical on it. All right, those were the 10. Let me give you a couple more things that I'm keeping my eye on. I think a major movement is going to be in marketing. Marketing healthcare is going to change in 2020. I think health systems are going to start requiring real measures and real results from marketing groups. I think they're going to change how they function and how they operate. One of the things that we are hearing over and over again is the most important tool for healthcare is Google search. And I know that some of you just turned off your podcast, but it is literally the front lines of care. 1 billion health-related searches are done a day on Google search. It is the front lines. It's where people are going to find out, where should I go? What do I have? And if I were working for a health system marketing team and they were to tell me that they spend more money on sponsoring the baseball stadium than Google ads, I would tell them that they've missed the boat. They should be figuring out a way to insert themselves. They've been disintermediated already. People are going to Google instead of to their primary care physician because it's just easier, right? It's on your phone. It's right in front of you. It's right in front of me. I could ask all sorts of questions right now. So that's it. How do you insert yourself in that process? How do you get back in that process? You can pay to get back in with Google Ads, or you can, try to work some way around that system. The other way, Google search, the voice assistants have an all new search algorithm that you can insert yourself into, and there's a whole new field of play out there for positioning within search on voice assistants, and that should be being looked at. Marketing people, much like IT people, have got to be more sophisticated, and I think that's going to start happening in 2020. I think it started to happen in 2020. I think it's going to be the year that it's going to make a move. And then the last thing I would say is I think the mergers and acquisitions are going to slow down significantly. Now we'll see, going to the JP Morgan conference next week, we'll see what people are talking about, but healthcare continues to play monopoly, but the regulators, I think, are starting to be onto this whole thing. They are looking at the research. The research does not support that outcomes improve at all, and it does not support that costs go down at all, or that access to care improves at all. And so we have a problem. We have a problem, and that's what we're using to sell these mergers, and that is not what's really coming out as a result of it. Now, Rod Hochman, in one of his points, makes that this is the year that you're going to see that progress. And I hope that's the case. I hope it just takes a little longer than we think. But to date, we have not seen that progress as quickly as we should see that progress. And so state regulators are starting to look sideways. And I think they're going to, now what they're doing is asking for bigger concessions on these mergers. But I think what you might see is they might start turning them down. We'll have to see where it goes. Anyway, those are what people are looking at for 2020, the year of perfect vision. So hopefully we have this right. Hopefully we're focused on the right things. It's not necessarily, to be honest with you, when these things came out every year as a CIO, I sort of glanced at them to see if what we were doing was right. What we did is we looked at those trends. We looked at the mega trends. We looked at society trends like around the aging population, the trends around our community, what type of people were moving in, what was the demographics, how were they consuming healthcare, where were they looking for their healthcare information, and then we built out models over a 5-year time frame to build out those continuum of cares and the continuum of care, transitions of care, and those kind of things, and digital tools that were going to be required to serve that population. That's how we looked at it. And then what I would do with these trends, to be honest with you, is just say, are we still trending where we thought we were? Do we need to adjust any of those assumptions? So maybe you're doing the same thing. Maybe you're not. Maybe you're putting an awful lot of stock in these things. It sells newspapers, which is why I think everybody came out with their, trends for 2020 2019, 2020. And I am now a part of that cabal, if you will, to sell newspapers by talking about predictions, I guess. So I am a hypocrite. I talked about them. Next week, we will get back to the news. We will look at 10 stories, and I'm looking forward to that. And then the following week, we will do our annual JP Morgan conference rundown, because next week on Tuesday, I'll actually be at the JP Morgan conference. I'm going to record probably on Sunday the news show for next week. So looking forward to that. Hey, that's all for this week. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com or the YouTube channel. Special thanks to our sponsors, VMware and Health Lyrics, for choosing to invest in developing the next generation of health leaders. Thanks for listening. That's all for now.